Nausea. Ugh, it's a feeling we've all had, right? And one we all want gone like yesterday. But what happens when it's really severe? Think about coming out of major surgery or going through chemotherapy. That's where modern medicine has some pretty incredible answers. And today, we're going to pull back the curtain on one of the most important ones, ondansetron. So here's our roadmap. We'll start with what this drug even is, then get into the really cool science of how it works. We'll cover when doctors use it, go over some super important safety info, and wrap up with the practical stuff, how it's actually taken. All right, first up, let's get properly introduced to ondansetron. And I gotta say, this wasn't just some new pill on the market. It was a total game changer for treating nausea. And before we get any deeper, let's make sure we're on the same page with this key term. An antiemetic is just the medical way of saying a drug that fights off nausea and vomiting. Simple as that. You've probably heard of it under brand names like Zofran or Zuplenz. Well, ondansetron was the very first of its kind. See, before it came along, a lot of anti-nausea meds would just knock you out. They came with some heavy-duty side effects. Ondansetron was revolutionary because it was so targeted, which made managing that awful post-surgery or chemo-induced nausea so much more tolerable for patients. Okay, let's get into the science, because this part is it's really fascinating. How does a tiny pill or an injection actually shut down that overwhelming feeling of being sick? Well, it all comes down to a really clever block. Think of it like this. When your body gets a major trigger, like anesthesia or chemo drugs, it floods your system with a chemical messenger called serotonin. Now, this serotonin acts like a key, and it's looking for a very specific lock called a 5-HT3 receptor. When that key turns the lock, boom, a nausea signal gets fired off to your brain. What ondansetron does is just brilliant. It's like a key that gets into the lock first and then breaks off. It completely blocks the receptor, so the real serotonin key can't get in. The nausea signal is stopped dead in its tracks before it can even start. And here's what's so cool about this. Ondansetron isn't just working in one spot. It's basically fighting a war on two fronts. It works centrally, right in the nausea control center of your brain, but it also works peripherally, way out in your gut where a lot of those signals get started. This double action approach is a huge reason why it's just so darn effective. And for anyone who's ever felt that awful rising wave of nausea, this right here is the best news. It works fast. We're talking within 30 minutes, you start to feel relief. I mean, that can feel like an absolute lifesaver. And that relief is going to stick around for about 3 to 6 hours. So we know how it works, but who's it actually for? Let's talk about where this fits into the real world. It's a powerful tool, for sure, but it's meant for some very specific jobs. Its two main gigs are fighting post-operative nausea and vomiting, that terrible feeling after surgery, and chemotherapy-induced nausea. And these are some of the most intense, relentless types of nausea you can imagine. And what's more, because it works so well and is pretty safe, it's become the go-to antiemetic for kids. Okay, let's switch gears for a minute because this is obviously super important. With any powerful medicine, you have to understand the safety side of things. So for this part, we're going to be really clear and direct. So, these are the big red flags, the absolute do not take situations. If you've had an allergic reaction or hypersensitivity to it before, that's a non-starter. Same goes if you're taking a specific Parkinson's drug called apormifene, because that combination can cause a really dangerous drop in blood pressure. It's also off the table if you have severe liver problems, a blockage in your gut, or a known heart rhythm condition called prolonged QT syndrome. Now, separate from those big red flags are potential side effects. The good news is most people handle ondansetron really well. The most common things you might run into are a headache, maybe some dizziness, or feeling a bit drowsy. Less common, you might see things like hiccups, shivering, or chills. And while serious changes to your heart rhythm are rare, they are possible. This right here is a really important warning, especially for doctors and nurses. Because ondansetron is so good at stopping nausea and vomiting, it could actually hide the signs of a bigger problem, like a bowel obstruction after stomach surgery. It basically means the medical team has to stay extra vigilant and can't let their guard down. Now what about pregnancy? This is where things get a little more nuanced. Usually, in the first trimester, another medication is the first choice. But for really severe cases of nausea later in the pregnancy, when nothing else is working, ondansetron can be an option. The key thing, though, is that because of that tiny risk to heart rhythm, ECG monitoring is recommended. All right, we're in the home stretch. Let's get down to the practical stuff. How is this medicine actually given to a patient? One of the great things about this drug is how flexible it is. In a hospital, an adult will often get a 4 milligram dose through an IV or an injection for the fastest possible relief. For using at home, there are oral dissolving tablets or films, usually in that 4 to 8 milligram range. For kids over 6 months, the dose is always calculated very carefully based on their weight, but you can see some of the standard doses here. And hey, if you ever have to take one of the dissolving tablets, the ODT, this is super important. They're really fragile, so you don't push it through the foil like you would a normal pill. You just peel back the foil, gently take it out, pop it on your tongue, and let it dissolve. You don't even need water. So when you put it all together, Ondansetron isn't just some random anti-nausea pill. It's a precisely targeted, incredibly effective tool. It's designed to shut down a very specific pathway in our body to bring relief during some of the toughest medical moments. And that really brings us to our final thought here. It's no question, this is a powerful solution. But as we've seen, especially when we talk about things like pregnancy, its power means it has to be used really thoughtfully. It kind of makes you wonder, when you have a tool this effective, how do doctors make sure it's not just an option, but always the right option for that specific person at that specific time?